You've been prescribed a medication called epinephrine, commonly referred to as adrenaline, and is given what is known in as an EpiPen single-use autoinjector because you have had a severe reaction to bee stings. These reactions can be life-threatening, causing a condition called anaphylaxis, which can cause the throat to swell and restrict breathing and drop a person's blood pressure. Epinephrine is what's known as a vasoconstrictor, and what this means is it causes blood vessels to become smaller, which will raise the blood pressure back up. A drop in the blood pressure is an occurrence in anaphylaxis and needs to be immediately addressed. Epinephrine also causes the muscles in the throat to relax again, therefore allowing the person to be able to breathe more easily, and in addition to raising the blood pressure, causes the heart rate to increase, which will cause blood to flow faster throughout the body. After the medicine has done what it needs to do within the body, it's metabolized to the liver, other tissues, and the sympathetic nerve endings, and it's excreted through the urine. Epinephrine can have some uncomfortable side effects as well. It can cause you to become rather pale. It can cause you to feel all sorts of tremors and maybe have some anxiety or some heart palpitations. These are often side effects that you see when you go through what's known as a fight or flight, when your body isn't sure whether it's going to fight or whether it's going to run away. So you get all sorts of shaky and just not sure what to do with yourself. So even though these side effects can be rather unpleasant, it's not reason enough to not take the epinephrine, the EpiPen, when it's needed, because these side effects far outweigh the risk of not using your EpiPen. The EpiPen's given intramuscularly, which means it's going to be stuck into a large muscle, most commonly right into the thigh muscle, and this can actually go through clothing. The needle injector can actually be injected through clothing. So there's no need to be concerned if you're wearing jeans or thicker clothing, the needle is going to go through. Within about 5 to 10 minutes, you're going to start feeling the effects of this medication kicking in, and within about 20 minutes, you're going to start feeling any of those odd, shaky sensations, the palpitations, the paleness, the feeling of being all jittery and being like, and your heart might feel like it's beating oddly. Those are the heart palpitations that we discussed earlier. And this medication is going to last anywhere between 1 to 4 hours after administration. Anytime that you need to use your EpiPen, you do need to immediately seek medical help, even if you do feel a relief of the effect of the anaphylaxis, because a second occurrence can happen. It does come in 2 different doses. There's a dose for adults and there is a dose for children, and the children's doses are actually based upon weight. An adult dose should never ever be given to a child because it can actually have the adverse effect on them, and instead of making them feel better like it would a full-grown adult, it can actually cause their heart to race too much, and it can put them into what's known as an arrhythmia, and that can be lethal. That can cause the heart with those palpitations. It can cause the heart to go all sorts of offloaded and cause the child to die. The adult dose comes in what's known as a 0.3 milligram amount, and if after 10 to 20 minutes you're not feeling relief from the EpiPen, a second injection may certainly be given. Of course, again, if you ever need to give yourself an injection of this medication, you do need to contact 911, have somebody bring you immediately to the hospital. You need to be seen by a physician and a team in the emergency department. Always keep this medication on hand, and actually consider getting a medical bracelet so other people would be aware of your allergies as well. And friends and family should definitely know how to use this auto-injector, because you may not always be in a position where you can give it to yourself. Some people go into anaphylaxis within 5 minutes. Some people go into anaphylaxis even hours after receiving the poison that may, or food or anything like that may actually cause them to have this adverse effect. So definitely make sure that your family and your friends know how to give it. And also ensure that this medication is always kept away from children, especially because the EpiPen is very easy to accidentally use and inject into yourself, and you don't want a little one to accidentally be injecting themselves with this medication, because it can hurt a child quite a bit. So always keep this medication on hand, wear a medical alert bracelet, and make sure your friends and family are aware of your allergies at all times.